Welcome back. In the previous session, we have discussed about reproductive and child health care programs and its objectives. We also discussed how to control population explosion with the help of contraceptive devices. Now, in certain cases, there are chances of abortions also. MTP, medical termination of pregnancy or induced abortion. Why does this happen? Termination of pregnancy. Termination means the pregnancy is not allowed to complete the full term of 9 months. Before 9 months itself, pregnancy is terminated or stopped medically, that is with the help of doctors. So why do people go for MTP? There are 2-3 reasons. One, after diagnosis and proper healthcare checkup, the doctors may find that if the pregnancy is allowed to complete the course, one, it may pose certain risk to the health of the mother, grave risk of death also. Or second, on diagnosis, the doctors find out that the child has some kind of deformities which is life threatening, and if allowed to deliver, the child may have permanent handicap. So in these two reasons, medical termination of pregnancy is allowed, and usually this is done in the first trimester, that is in the first 12 weeks, where the risk associated is very less. In the Medical Termination of Pregnancy Amendment Act 2017, MTP is allowed after 3 months also, but before 6 months. So in between 3 months and 6 months also, legal abortions can be carried out with the consent of 2 qualified doctors who have to agree for the procedure. Medical termination of pregnancy is also done in cases where the couple is using a contraceptive device, but the contraceptive device has failed and pregnancy has been achieved. So if the couple does not want a child at that particular point of time, they can opt for medical termination of pregnancy in qualified nursing homes with proper legal permission. And also sometimes what happens is youngsters, they have casual unprotected sex which can also result in pregnancy. This also they can go for MTP. The problem is this MTP is done mostly illegally because of social stigmas associated. So it is done by unqualified nurses, etc., which pose a lot of risk to the mother as well as to the child. Not only that, MTP is used illegally for female feticide along with the help of amniocentesis, where the couple go for detection of the gender of the child. Once they find out that the child is female, they go for illegal MTP, that is in nursing homes or clinics which are not qualified to do that. This can pose a serious threat to the life of the mother also. So that is about medical termination of pregnancy, where the pregnancy is not allowed to complete the full term and it is ended with the help of doctors. Since we are talking about a reproductively healthy society, it is very important to talk about sex related diseases which we discuss in the topic STD or STIs, sexually transmitted infections. As the name itself suggests, these are infections that are spread due to sexual intercourse, basically unprotected sexual intercourse, which these diseases can then be spread from an infected person to the healthy individual. Now, we will discuss about what are the causes for sexually transmitted infections, what are the symptoms, how do they affect the health of an individual, and how to prevent it. So this is an important portion for 3 marks. So causes of sexually transmitted infections, it could be caused by bacteria. For example, we have gonorrhea, syphilis, chlamydiasis. These are all bacterial. Then this could be spread by virus. So in virus we have herpes, genital herpes, warts. Then we have hepatitis B, and the most deadly of all, HIV, which causes AIDS. All these are sexually transmitted infections spread by viruses. We also have trichomoniasis, which is spread by a protozoan, Trichomonas vaginalis. So when a person is infected by these sexually transmitted infections, it shows certain symptoms. In some cases it is asymptomatic, meaning the person has contracted these infections or diseases, but there are no telltale symptoms of it. So the common general symptoms of sexually transmitted infections are itching or irritation near the genital organs, that is one. There could be rashes or redness near the genital area, swelling, smelly fluidic discharge, etc. These are the common symptoms of sexually transmitted infections. In case where symptoms are not there, it goes undetected, and this poses a serious risk, because unknowingly, if these people have sexual intercourse with other individuals, they can pass over these diseases to them also. Therefore, it is very important that for a reproductively healthy society, the sexually transmitted infections should be easily and detected at an early stage. That is number one. Number two, these people should then go to a doctor and undergo complete treatment so that the STI is cured. Most of the sexually transmitted infections are curable except hepatitis B, HIV, AIDS, and genital herpes, which take a long time or which are incurable. Hepatitis B and HIV, AIDS, they don't have any cure. If these sexually transmitted infections are not detected in the early stage and not treated, in the future this could have serious reproductive related disorders or health disorders. Some of the common health hazards that STIs pose, they can result in pelvic inflammatory diseases, all the inflammation related to the reproductive tract or pelvic area. They could result in abortions, in stillbirth. As you can see, the child is born but it is dead. Stillbirth is usually seen after 5 months. So after 5 months the delivery is done but the child is born dead. Before 5 months, if the child is born dead, we call it as a miscarriage. It could be due to lot of reasons. One of the reasons could be sexually transmitted infections. That is one. Ectopic pregnancies. Ectopic, that is, these are pregnancies which take place outside the uterus. Under normal circumstances, the zygote, that is the morula and the blastocyst, will come and implant itself to the endometrium wall of the uterus. In ectopic, ecto, outside, the pregnancy is in the regions, especially in the fallopian tube. Because of this, there is a risk of the fallopian tube bursting open and resulting in severe bleeding. So this was a serious threat to the health of the mother. Ectopic pregnancies, they also result in cancer of the reproductive tract, ovarian cancer, etc. can also be seen. So these are all the effects of sexually transmitted infections. How to prevent sexually transmitted infections? So very important is early detection. These STIs should be detected early and treatment should be given. Prevention can include three important steps. Of course, the simplest one is avoid having unprotected sex with unknown people. So avoid unprotected sex with unknown partners or with multiple partners. Always use safety measures such as use condoms, which will provide protection from sexually transmitted infections. And if there is a doubt, in case of doubt, visit the doctor. The diagnosis is showing that the infection is seen, then it is better to complete the full course of treatment so that in the future this can be avoided. So that is about sexually transmitted infections, and especially these sexually transmitted infections are seen in the age group of 16 to 25 years, the adolescent age. So creating awareness in schools and colleges is very important to prevent sexually transmitted infections. Since we are talking about reproductive health, there is a portion in the society which do not have normal functioning reproductive organs, or the reproductive organs may be non-functional. In such cases, these individuals are unable to produce children. That is what we will discuss in the next topic, because for a reproductively healthy society, one of the definition was that they should have normal functional sex organs. Certain couples, they are unable to bear children even after prolonged unprotected sexual cohabitation. They are not able to produce children. This condition is called as infertility. It means they are not using any contraceptive devices, still they are unable to bear children. Now there could be many reasons for infertility. Why is a couple not able to bear children? Meaning there could be some issues with the male, there could be certain issues with the female, or there could be issues with both. These could be due to maybe physical reasons, maybe the reproductive organs are deformed or not well developed, or they may not be able to produce gametes. If gametes are produced in case of males, the number of gametes, the sperm count may be less, or these gametes may not be able to fertilize, fuse, or in the case of females, after fertilization, the zygote is not able to divide and grow, or it is not able to implant itself to the uterine wall. So there could be a lot of reasons which may be due to physical reasons. It could be due to sexually transmitted infections, as we already discussed. In the future, STIs can cause infertility also, or other issues. It could be due to diseases. It is a well-known fact that people with diabetes after certain age, they have lower levels of fertility. So diseases could be one thing. It could be immunological reasons. The body is rejecting the zygote or the fetus. That could be a reason. Or it could be psychological also. So there are various reasons due to which a couple is not able to produce children. Now, for these individuals, for these couples, there are measures available, there are ways available for them to bear children. There are specialized clinics called as fertility clinics. These couple can approach them with the help of counseling. Any minor issues can be sorted out and they can be helped to have children. In case the issues are major, like the ones we discussed before, maybe they are not able to produce the gamete, number one. Number two, the gametes are not able to fuse within the reproductive tract of the female, or the fertilized egg zygote is not able to implant itself. Under these circumstances, there are a set of techniques available called as assisted reproductive techniques or assisted reproductive technologies. We call it in short as ART. As the word says, these are specialized techniques or technologies which are available, which will assist or which will aid or help the couple to have children. So, assisted with the help of technologies, a infertile couple can be made to have children. So, under assisted reproductive technologies, there are lot of technologies about which we will discuss now. So, it includes techniques like IVF, ET, also technique of ZIFT, then we have GIFT, we have ICSI, we have AI, and we have IUT. So let us discuss about this in brief. This is an important 5-mark question. What are ARTs? Explain any 2 or explain any 4 with the help of examples. So the first technique is called as IVF-ET. Commonly, popularly it is called as the test tube babies. IVF, in vitro fertilization, which is followed by embryo transfer, as the word itself says. This is for individuals where fertilization is not possible inside the female tract due to problem either in the male or in the female. So, in vitro fertilization, the gametes, the ovum and the eggs are collected either from the couple or from donors, healthy donors. These gametes are then made to fuse under artificial conditions inside laboratory, in vitro, in test tubes. Vitro means glass. This zygote is then provided natural conditions outside in the test tube. This zygote is then made, induced to divide. It will then divide, and the embryo so formed is then transferred back into the female, or maybe a surrogate mother in case the female is not able to conceive. Embryo transfer. So here in embryo transfer, if when zygote divides, in case of the stage of morula where it is 8 blastomeres, then the embryo is transferred directly into the fallopian tube, because we know in the 8-cell stage the embryo is still in the oviduct or fallopian tube. That is what is called as ZIFT, zygote intra-fallopian transfer. The 8-celled blastomeres are transferred to the fallopian tube, where it is then allowed to grow naturally. That is called as ZIFT. Then there is another technique called as GIFT. In this case, the female is not able to produce ovum. Ovulation does not take place due to some reason. So this is what is called as gamete intrafallopian transfer. The ovum from a healthy donor female is injected into the fallopian tube. Then the natural process can continue. So, gamete intrafallopian transfer. This is for females. In case of certain issues with the male partner, there is a technique available, that is AI, artificial insemination. This is undertaken when the male partner is unable to inseminate. Insemination does not take place inside the vagina, or the sperm count is very less. So then the semen from a healthy donor is injected or inseminated into the vagina or into the uterus. That is what is called as artificial insemination. Sometimes there is another technique available, that is called as intracytoplasmic sperm injection. Here, with the help of micro pipette or micro needles, the sperms are directly injected into the cytoplasm of the ovum. If the sperm is not healthy, then this technique can be done. So, under microscope, the ovum is removed, the sperm is injected directly into the cytoplasm. Intracytoplasmic sperm injection. And one another technique is intrauterine transfer. In this case also, the sperms from a healthy donor male is injected directly into the uterus. This is what is called as intrauterine transfer. All these are techniques to make sure that the infertile couple is assisted so that they can bear children. That is all about the lesson reproductive health. Thank you.